What is bradycardia? Bradycardia is a condition characterized by an abnormally slow heart rate, typically below 60 beats per minute. It can result from various causes, including aging, certain medications like beta blockers, heart diseases such as coronary artery disease or myocarditis, electrolyte imbalances, hypothyroidism, or an intrinsic problem with the heart's electrical system. Symptoms of bradycardia may include dizziness, lightheadedness, fainting, fatigue, shortness of breath, chest pain or discomfort, and confusion. In severe cases, bradycardia can lead to inadequate blood flow to vital organs, resulting in symptoms like fainting or even cardiac arrest. Bradycardia occurs when the heart's electrical signals slow down or become disrupted, causing the heart to beat too slowly. This can impair the heart's ability to pump blood effectively throughout the body, potentially leading to symptoms and complications. While some individuals with bradycardia may not experience any symptoms, it is essential to monitor and manage the condition to prevent complications and ensure optimal heart function.